So hi, I'm Ross Camidge. I'm the Director of Thoracic Oncology at the University of Colorado Cancer Center. And this is a discussion about a study involving two drugs. So one is called VS6766, which is a combination RAF-MEK inhibitor. And then it's being used in combination with a drug called Defactinib, which is a FAK inhibitor. Now, how did I get involved? So I had been looking through the abstract from AACR earlier in 2020, and I came across this early phase study with this combination showing fairly dramatic responses in actually in patients with ovarian cancer, but there seemed to be a signal suggesting that many of the patients who were responding had a specific KRAS mutation called G12V. Now, I'm a thoracic oncologist, and G12V is the second most common KRAS mutation in lung cancer. We'd seen over the last couple of years that a different class of drug called G12C inhibitors had shown activity. And so I was pretty excited. I was thinking maybe this is going to be a drug for this other thing. And so I'd worked with Verastem before. And so I didn't wait for them to contact me. I reached out to them and said, hey guys, have you thought about developing this in lung cancer? And that's how the relationship began. One of the things is we have started to understand that KRAS, which is kind of an elephant in the room in lung cancer, it's the single most common class of mutations in lung cancer, but there hasn't been drugs for it until recently, has become actionable not by having one drug for everybody, but by recognizing that there's heterogeneity even in KRAS. So KRAS G12C inhibitors have shown activity with response rates ranging from 30 to 50%. KRAS G12V doesn't have a magic bullet yet. And so the idea that there may be a drug or combination of drugs that's specifically active in G12V was very exciting for me because these patients have an unmet need. They represent somewhere between 6 and 7% of lung cancer. That's more common